First time I was diagnosed with ulcerative colitis, I did go to Denver Health. That was back in 1998. It was a simple thing. Sometimes it went into remission. Recently, it came back like really strong, and I was in Denver Health for about a week, and they got me involved with Remicade treatments. Because I was working so much, my Medicaid ran out. In the meantime, while that happened, I stopped doing treatments.
He got to the doctor appointment. Doctor wheeled him to the emergency, and from there, he was dehydrated. His heart rate was really low. His blood pressure was low. Everything you can imagine was not good.
I did not know that Rudy had stopped his medication because of his insurance loss. And so the next time I saw Rudy was when he came into the hospital in October of 2019. And I was shocked to see how sick he looked at that time and really was a shell of his usually bright, positive self. Rudy was admitted to Denver Health and did immediately go to the ICU. There was a small time where we thought maybe we could adequately get his disease under control with medication, but it became very obvious very quickly that he was too sick for just medication and that he'd require surgery. When Rudy was in the surgical intensive care unit, he was not just there because of his ulcerative colitis. He had multiple organ systems that were failing him.
Doctor told me he was in very critical condition. It was just one thing after another. It was like nothing was getting better. And then when he got the double pneumonia, his lungs were not doing well.
He required a breathing tube in order to help him breathe. We required multiple services that were involved in his care given how sick he was. We had the kidney doctors, the lung doctors, the infectious disease doctors, the gastroenterologists, all involved in his care trying to make him well. Despite all of the care he got, he was very sick still, and we were worried that at one point we might lose Rudy.
Chance was like less than 20%. They just did everything. They never gave up. And that gave me hope, because they were still, no matter if the doctor was saying less than 20%, they were still working on him and caring for him. But it was just heart-wrenching to watch everything he had to go through, because I really thought I was going to lose him.
I woke up and I was a little disoriented. I was looking around and I was like, what happened? Where am I? What's going on? Where's my sister? And I was so grateful that I woke up and I saw Michelle, and she was the first person who came in. When she saw that I was awake and coherent and I was doing okay, I remember she had tears down her eyes, and she put her hand on my arm. She said, "Rudy, we thought we lost you, but you're like a Christmas miracle." And I remember her saying that.
If you walk around the surgical ICU unit and you mention the name Rudy, everyone's face lights up. Everyone remembers the love that he had for us, the cheer that he brought to the floor, the positive attitude that he had, and how hard everyone fought to keep him alive, and how much of an impact he had on their lives.
I remember I would go into the ICU and hold his hand and just make sure he was okay. And even with a breathing tube in his mouth, somehow he would muster a smile for me.
She checked in on me all the time over there, and I can't say enough about the doctors and the nurses, the CNAs, the people who came to clean my room. The care that they gave me after I woke up was just phenomenal. I mean, it takes a special kind of person to care for somebody in their darkest moments, in their most vulnerable situation. And I'm extremely grateful for every single one of them.
It is amazing the transformation that has happened since he got out. He has built his muscle strength back, he's gained weight, and he told me that he's basically back to his life pre-hospitalization. But Rudy has really taught me the importance of listening to patients and hearing their stories. When you come to Denver Health for your care, you know that you're going to be cared for by providers, nurses, other ancillary staff that want to be here, that love to be here, that are here for the mission and here for the patients.
There's a sign that says from critical to miracle. I told him that's God telling me everything's going to be okay. And it was. It was. My heart is so grateful to all of them, to every one of them that was involved in his care.
I have a very different outlook on my life now. I believe that I owe it to Denver Health, my sister, and everyone who went through that with me, my mom, my family, the doctors and the nurses and everybody at Denver Health. I feel like I owe them to live my life to its fullest every single day, because you don't know how long you have, you know, and they made me appreciate life.